Hey, I'm Dr. Seiler from Seiler Skin in Birmingham, Alabama, and today we're going to shoot a video on the vampire facial, one of our favorite new treatments for patients. This is a three-step process. The first step is an application of a medical-grade numbing cream so that it makes the procedure completely painless. The second step is drawing a small amount of blood, which also is a painless procedure, and using an FDA-approved process to obtain the platelet-rich plasma from the blood. And the third step is a medical microneedling procedure that introduces the PRP into the patient's skin to achieve the expected result. So let's get started. Hey, so we're checking back in with Casey here. She's had the numbing cream on for a little bit of time. We're about to start the blood draw process and just wanted to show that she's perfectly comfortable. The numbing cream, I think, is starting to take effect, it sounds like.
Yeah, a little bit.
Starting to make your skin numb.
Mm-hmm.
Good, no discomfort. You can see this is a great medical grade numbing cream, so she doesn't have any reaction to the cream itself. Alright, so this is step 2 of the vampire facial. This is a painless blood draw. We're drawing blood here to be able to obtain the PRP, which is the good stuff, the magic behind the procedure. So just wanted to show that this is a quick, painless process. Alright, so we're going to film the step 2 again on this patient. We're going to film 2 patients total today to show different types of skin, different ages getting the procedure done. We're going to show the sterile blood draw here, which again is the same on any patient. We're going to spin this down in a FDA-approved centrifuge to obtain the PRP, platelet rich plasma. That centrifuge will separate the red blood cells from the plasma. The plasma is what makes this procedure great and causes collagen stimulation. Alright, so our centrifuge just stopped spinning here, and I wanted to show that this is a very special centrifuge, unlike those in a normal lab. This process is actually, and the system is actually FDA approved to not only obtain the blood and spin down the PRP, which you see here is yellow. So for those of you getting this procedure, this is a very clear liquid that's put back on the skin. But this is a process that's FDA approved for actually using it on the skin and not just obtaining it, as opposed to a normal lab where it's not FDA approved to use that blood on skin or re-inject that blood. So we'll use this for our vampire facial coming up. Alright, so this is the main and third step of the vampire facial. This is the medical microneedling. We use a little bit of the PRP, the platelet-rich plasma, topically. And the medical microneedling will help create little channels in the skin to introduce that into the skin. The science behind the use of PRP has actually been around for over a decade. I used platelet-rich plasma and plasma gel when I was a surgery resident about 12-13 years ago to help wound healing in the wound center and surgery residency. It's kind of interesting that the orthopedic guys have been using this for a decade, and only in the cosmetic world have we realized how much this can really help prevent and treat certain cosmetic conditions. And we've been using this in our practice for over a year, although this procedure's been done for a couple of years. So here you can see a little closer shot of us treating the face, and again, in this patient who's 46, we're treating her for fine lines, texture, and wrinkles. The medical microneedling itself will stimulate collagen, but the big part of this process is the use of the platelet-rich plasma to be introduced deep into the skin to stimulate collagen. So just like we do with lasers where we get deep into the skin to stimulate collagen, this will actually do similar things without causing near as much downtime. We're about to start treating the cheeks here in just a minute after she's done kind of putting on a final layer of the PRP. We've already finished the forehead here, as you can see.
Hi, I'm Adina, and I am finishing up on our patient's neck with the microneedling with PRP. And as you can see, her face is complete. She's got a little redness, but she's tolerating it beautifully. On the neck, we're treating for the fine lines and wrinkles, the area of the necklace lines, and across to the center of the neck. She's doing great. We're finishing up the microneedling process. on the patient's décolleté and chest. Again, for some of the lines and wrinkles in this area.
This is really good for what we call cleavage lines on the chest. All right, so we're going to do the vampire facial on our patient here who's 25, and so I wanted to show that we treat patients of all ages, skin types. She's doing this a little bit more for maintenance. She's got great skin and wants to keep it there, so this is also a good treatment for someone who has good skin already and just wants to keep it looking good. You're never too young to do maintenance treatments to keep your skin looking good. I want to talk a little bit about the device itself. So this is a medical microneedling pen, much different than something you can get over the counter or buy yourself, or that might be done in a spa. This will introduce small little channels into the skin through a series of tiny little needles that you really don't even feel. Are you feeling anything at all?
No.
So she's completely numb. You can see after the medical numbing cream that we use. We do passes up and down, left, right, and then in circles to really ensure that we get a good uniform treatment of the entire skin. We put a little bit of PRP on before as a glide. The microneedling helps to introduce that into the skin, and then we put some more on topically after until those little channels in the skin kind of close up. You'll be able to see here in a close-up in a minute that she's got just a little bit of pinkness to the skin, but that's it. All right, so we're going to do a little post-interview with our patient here. We just finished the full vampire facial, face, neck, and the upper chest here. And as you can see, she barely has any pink at all. She's got beautiful, healthy skin, and she's doing this for maintenance, so she's not gotten very red at all. What did you think?
It was great. It wasn't all what I was expecting.
Good, good. This is her first time to do it, so she didn't know what to expect, but as you can see, she tolerated this really well, and just wanted to show those watching how easy this treatment is to get through and the fact that you really have minimal downtime afterwards. So we're excited to see her results over the next couple of months. All right, so this is our second patient that we've treated today, face, neck, and chest with the vampire facial. And as you can see, she's got a little bit of pink in her skin, a little bit more than our other patient. We did a pretty aggressive treatment on her. This is actually her third treatment. So I was going to let her share her experience with today and her redness and what she's seen from the other treatments.
Yeah, so this was my third treatment. I have seen great results in improving some textural issues and fine lines and wrinkles. I do get a little redder than some patients do, but by tomorrow you'll barely even know I had the treatment done. I'll be able to wear makeup and look just like my normal self.
Good. Excellent. So that's the vampire facial for this patient, and we'll look forward to seeing her results.
I'm one day out from my vampire facial. As you can see, my face doesn't have any redness. I'm only a little pink on my chest. There was no discomfort after the procedure. I've been fine. My skin feels great, and I'm excited to see how it goes.
Hi, I'm one day post my vampire facial, and I still have a little bit of redness on my neck and chest, a little bit on my face, but as you can see, it's easily covered by makeup. My skin feels great. I had no discomfort, and I'm excited to see the results.
All right, so now you can see that our patients look great the day after their procedure. We are really excited for them, and so are they, to see their results over the next couple days to weeks. Usually patients see great results right away, but their results continue to get better for 3 to 6 months and even longer after the procedure. This has really become one of our favorite procedures here in my practice, even though I love my laser treatments, because of the lack of downtime and the great results, and our patients feel the same way. So for more information on the vampire facial, visit our website at seilerskin.com. Our practice is here in Birmingham, so you can call our office, and you can also click on the link in this video for more information. So thank you so much for watching, and we hope that you take advantage of the vampire facial here at Seiler Skin in the future.